Hi everyone, I'm Matt Thompson, I'm the Chief Medical Officer for Endologix. I'm previously practicing vascular surgeon. I'm here at the VEITH 2019 Symposium and I'm welcoming this opportunity to talk to you about my role at Endologix, particularly with regard to assessing graft performance. One of my jobs as Chief Medical Officer for Endologix is to try and understand how our diverse portfolio of grafts is performing in the real world. Now, we have to acknowledge that different endograft designs have different strengths and they have different complications, and for that purpose, when we assess endografts, it's very important that we look at multiple parameters of performance. So clearly single failure modes are important and they need to be weighted appropriately, but we really need to assess endografts holistically. So when I think about the data sources that we need to assess endografts, they need to be valid, they need to be verifiable, and they need to be unbiased. So I think what that means is that we need multiple data sets to assess graft performance. Ideally, we'd like those data sets to be large. We'd like them to be independent to a certain extent. And also it's important that there is a comparator, so you can directly compare one graft against the other. So in terms of the data sets that I have available to me to look at, we have a level 1 randomised controlled trial, the LEOPARD study. But we also have made an effort to garner an independent data source, which is a very large data set, but it's independent, it is unbiased, it is real world, and it has an active comparator. In addition to that, we prospectively collect data on all of our grafts through our MDR, MDV process, otherwise known as the complaint datasets. That's obviously an internal data set, but it has the advantage that it encompasses nearly 60,000 patients. And then finally, we actually commission meta-analyses of our grafts in comparison to other endografts. And I think these 4 data sets in total really give us a comprehensive assessment of where our grafts are performing. So I think these data sets really help us when we're asked questions about the performance of our endograft. We can reference level 1 evidence, we can reference very large independent data sources, and we can reference our own very large complaint data set of nearly 60,000 patients. All of these data sets to me look concordant. There are no discordant findings, and therefore I think at present we have very good assurance that our current product in the market, AFX2, is performing well. At Endologix, we have a culture of accountability, and it's very important that we're accountable for our data to patients and to physicians.